Mrs. Johnson. How are you today? Good. That's good to hear that you're feeling better. Well, my name is Bethany, and I'm from the respiratory department, and I'm here to just give you some treatments today. Perfect. Can I just have you confirm your full name and date of birth for me? Thank you so much. And to start off with, I'm going to listen to your lungs. We're going to see how those are sounding, if that's okay with you. Just have you sit up here. Perfect. Take your pulse. Great, that all sounds great. So, it looks like the doctor has 3 medications ordered for you. The first one that we're going to start with is called Atrovent. And this one is a short-acting bronchodilator, so this is going to open up your airway and kind of make it easier to breathe. And this one starts working pretty quickly. And so this one we're going to give to you, looks like about every 4 hours. I will be in to give this to you, and this one is in a nebulizer treatment. So let me just hook this up to the oxygen here. And then I'm going to go ahead and I'm going to put this mask on you. The important thing to keep in mind is we just want to make sure to keep this cup upright. And then I'm just going to have you take normal breaths. Breathe normally with the occasional deep breath and hold. Perfect. All right. So some side effects with this one is you might feel your heart kind of start to race a little bit. You can get a little bit dizzy or nauseous. If you have any of that, just let me know. So now that we're done with that treatment, I'm going to have you take a big deep breath in and then cough for me. Great. So then the second one I'm going to give you is Salmeterol, and this one is a long-acting bronchodilator. And so this one is gonna work to keep your airway open. Since we gave you the other one, that one's gonna open it up for us really quickly. And then this drug is gonna last a lot longer, and this one's gonna kind of work to, like I said, keep your airway open all day. And so this one is in a dry powdered inhaler. So what I'm gonna have you do is I'm gonna have you exhale completely away from this, and then I'm gonna have you put your mouth around it and then inhale for as long as you can, or about 10 seconds. And then hold your breath again for as long as you can, or about 10 seconds, and then you can go ahead and exhale, okay? Perfect. Now, same thing again, I'll have you take a big deep breath and then cough for me. Awesome. And then the last medication that I have for you is Flovent. Now, this is a steroid. So sometimes when we say the word steroid, that can be kind of scary and people have a lot of concern about it. But this one is going to help with the inflammation that you have going on in your airway. This is going to reduce that a lot. One of the big concerns that I'll have you do is I'll have you rinse your mouth out after we're done, just to kind of prevent any sort of yeast infection or things that can go on in your mouth. And one of the side effects of this is thrush, but that's what we're going to have you rinse out your mouth to try to help prevent that. So it is in a inhaler, so we're just going to shake it up really good first. And again, I'll have you exhale completely away from the device. And then as you activate the inhaler, I'll have you inhale, hold for about 10 seconds or as long as you can, and then exhale. Perfect. And if I can have you take another deep breath and cough for me. Great. That sounds great. Now I'm going to go ahead and listen to your lungs again. Awesome. That all sounds great. Let me just take your pulse. Perfect. Would you have any questions for me before I go? Are you comfy? All right, great. You have a great rest of your day. Thank you so much.